Hello, welcome back, and I'm so excited to be here again today. Today we're going to actually talk about another nail problem. It's called onychodystrophy, or it's a problem with the nail that's not necessarily the subungual hematoma that we talked about yesterday or the onychomycosis. So there are multiple different reasons why you could get injury or changes to your nail. Sometimes you'll get a nail that's just yellow. So if you get a yellow nail, this can happen just as you get older and is not necessarily a problem, or it can actually happen because of certain types of nail polish and so forth. So if you have a yellow toenail, it's not necessarily a concern unless it starts to thicken and starts to have the crumbling underneath and the growth to the thickness of it, similar to what we talked about onychomycosis. So if you were to get a thick toenail that was slightly discolored, but it didn't seem to have the crumbling underneath, there is a possibility that you could have an abnormality of the nail caused by trauma. And this is just called onychodystrophy. So you can actually get injury to the nail or injury to the nail bed. It starts to change the way it looks, it starts to get thick. And as you take a piece of nail and send it off to be tested, it comes back as negative for fungus or any type of infective element. So it's just a thickened nail, traumatic toenail. The disadvantage of that is there's really only two different directions you can go as far as treating this. One is you remove the nail completely and kill it so it doesn't come back. Because if you just remove it and let it grow back, it will grow back just the same as it was, or sometimes even worse. Or there are different types of topical treatments you can put on it, or things you can do to it to thin it out. So you just thin the nail out and it's not problematic until it starts to thicken back up. So liquids that you paint on the nail that thin it out, or like I said, you can actually take a Dremel tool or something similar and thin the nail out so that it doesn't cause any pain. Typically, a thickened toenail like that is treated only if it's causing discomfort and pain, unless they decide to have the nail completely removed. There are other things that can happen to the nail as well. You can injure the toenail with running. It's called the runner's toenail. We will talk about that tomorrow because I think it warrants its own video, its own time to actually look at it and say, okay, well, what's exactly happening, why is it happening, and whether there are things you can do for it if you are a runner. So we'll come back to that later. The other things, you can actually have spots in the nail. They can be blue spots. They can actually have lines in the nail. And you can actually have even what looks like little pits in the nail, all indication of other issues. In certain races, you can actually have the lines in the nail, and that can actually be completely normal. A Bowes line can be normal, for example, in an African-American type individual. So really what it comes down to, if the nail doesn't look normal, you want it to be evaluated by someone that sees these nails all the time, and they can determine if it's a concern or not. There are types of cancer that can happen under or in the nail. Although they are rare, they can happen, so it's important that you get evaluated. A lot of times, if they can't tell you what it is, what they can do is take a little portion of that, take a little biopsy, send it off, and what it will allow you to do is get a full diagnosis of what's causing the problem and if there's additional things that you should do. So if your nail doesn't look normal and you don't feel like it's fungus, or maybe even if you do think it's fungus, you should be evaluated so you can actually determine what else needs to be done to help you resolve this problem, because there's no reason to continue to suffer with a nail that doesn't look normal. Most of the time, there are treatments that you can do and things that you can do to help your nail start to look more normal. Again, this is Dr. Brandt Gibson, and this is your Podiatry Tip, day number 11. And we just talked about onychodystrophy, or abnormal growth of the toenail. Tomorrow, we will be talking about runner's toenail, and then we will continue with some of the other things that are important for you to get health to your feet.